Good morning, good afternoon, good evening around the world. My name is Doug Brunke. I'm the founder and CEO of Global Chamber. We have a very special program today. Thomas Aksnes is the founder and scientific director at Health Optimizing. He actually kicked off our January Innovation Summit, our first one this year, with an overview of the health industry. Today, he's taking it to the next level by looking at the future, looking at what the trends are, looking where things are headed. And he is an extraordinary person to be able to do that. He's keynoted at over 100 health conferences. He's recognized as a worldwide as an expert in the medical field. His observations, his knowledge, his vision has been instrumental in getting Health Optimizing to be able to develop products and services that address market needs in an effective way, and has created growth for Health Optimizing along the way. So Thomas, thank you for your leadership in this area. We look forward to learning more today about the future. I really appreciate you taking the time.
Well, thank you very much, Doug. Happy to be here, and thank you for the nice introduction. So I will mostly be talking about the future, but I think first we need to also discuss a little bit, why is there a need for a change? Like, why do we need a paradigm shift in health? So let's look at the current model a little bit. And I mean, to look at it a little bit philosophically, like, what is the focus in the way we address health and medicine today? So the way things work now is that we wait for things to develop, to become a problem, for symptoms to arise. And we focus on the symptoms. And when I say we, I mean in the world today, not specifically we in Health Optimizing, because we actually do go a completely different direction. But what happens is that when symptoms arise, the symptoms are looked at as the problem, and the focus is on finding solutions that will reduce those symptoms. And when a pharmaceutical approach or any other type of approach is successful at reducing the symptoms, it is considered a success. So we measure success by the way the symptoms are reduced. I'm not saying that there's necessarily always something wrong with that, but what I'm going to show you today is that there is a different way. There is a more comprehensive way of fully resolving the health problems instead of just managing symptoms. And also what is important to understand is that a lot of the symptoms are actually associated with the healing process. They're not associated with what is causing the problems. So I'll give a couple of examples. If you get a flu, for example, you will get a fever and you will not feel that great. And that fever is actually your immune system increasing the body temperature, because you're able to fight the virus much better with a higher temperature. So when you have what is considered an extremely high fever, you have about 5 times more effective immune functions to kill a pathogen, whether it's a bacteria or a virus or another pathogens. You are 5 times more able to kill those pathogens when you have a high temperature. So this is an example of methodologies that our body have intrinsically to do a better job with whatever needs to be addressed. So the current way of addressing that, if it is a flu, for example, there's no medicine that is very effective against the flu. So the current way of addressing it is that we see the fever and feeling low on energy from the fever as the problem. And then a pharmaceutical is given, like paracetamol or something else, to lower the fever. And what happens then is that you actually work against the body's own mechanisms of fighting this. And a flu is a good example, because a flu lasts an average of 2 days longer if you use fever-lowering medicine. And of course, it makes total sense when you realize that the immune system can fight things better under a higher temperature. And this is how it is with a lot of other types of symptoms also. Pain, for example. if there is a healing process where the body is trying to recover or repair something, there will be a pain associated with that. And if you stop the pain, most of the ways to stop pain is to actually slow down the healing process, which means it might not recover fully. You see this a lot in with top athletes around the world in different sports. When they have an injury and it's very important for the team or for them to get back into the field very fast, then they will have injections of cortisone, they will have other types of drugs to stop the healing process so that they don't have too much pain to get back into the game. And what happens then is that this injury will not heal completely. It will heal to some degree, but not completely. And we have a lot of experience working with top athletes who's had a long career in different sports. And typically what we see is that all those injuries they had during the years, there is a lack of recovery and there's a lot of damages that we have to then stimulate the final repair of. So the body has its own mechanisms to deal with most challenges that we are exposed to. I mentioned healing processes, and there's pain associated. There are also other symptoms that could be associated. I mentioned immune processes, where then if it is important enough to fight the pathogen, you will even have a fever. But there are also other mechanisms. If we get exposed to something toxic, we will have a detox process, which also gives certain symptoms. A hangover, for example, is a good example of a detox process. There might be nausea and headache and other processes because there is a very effective detoxing process going on, and then there are symptoms associated with that. So whatever challenge we are exposed to, there are processes, intrinsic processes. Intrinsic means that these are internal processes that our body will use to deal with that. And these processes are really amazing. We have millions of intrinsic processes, such as immune processes, healing processes, different types of repair, detox processes, but also compensatory mechanisms. If something is not functioning properly, there will be other mechanisms to compensate for that. Things will be regulated differently in the body based on how we can cope with the situation in the best way during the process, while there will also be intrinsic processes to repair the problem. An example also is blood pressure. So if there is a reduced passage through the vascular system, it could be from plaque, and it could be from vasoconstriction, from some process in the body where the arteries are kind of narrowing in as just a vasoconstrictive process. What happens then is that we have to push harder to get the blood through the vascular system if the passage is more narrow. So pushing harder means increased blood pressure. And the very reason why we have a blood pressure in the first place is only to push blood and oxygen through the vascular system and deliver to the tissue. And when we no longer have a blood pressure, it means there is no longer life for more than seconds. So it's a very, very important function. And that function also needs to be sufficient. So when there is a reduced passage for whatever reason, or there is another reason why we actually need an increased blood pressure, then the blood pressure is such a dynamic process that it will naturally, intrinsically regulate. And the problem then is when we see that as the issue, that the high blood pressure is a problem. And this is what happens in medicine today, is that instead of looking into why there was a need for an increased blood pressure, the pressure itself is seen as a problem. And the reason for that is that there is a risk associated with a very, very high blood pressure. So even though the blood pressure increases for a good reason, it will only increase when there is a need for that. Then even so, there can be a risk associated with an extremely high pressure. But the threshold for giving blood pressure lowering medication is much, much lower than the threshold where the blood pressure itself causes problems. So these are just examples of where the current way of dealing with things, like a cardiovascular event, it's one of the big killers in the world today. We wait for an event to happen, and then all of a sudden, oh shit, why did this happen? What can we do about it? That's when one would look a little bit into causative factors after it's already too late, after there was already an event, and then you try to find out, okay, what factors are involved and how can we suppress those chemically. And whatever process it is that we influence chemically, we need to understand that the body has what's called a homeostasis. This is the balance of how everything in the body is working together. So if you force one change and introducing a direct chemical to influence one chemical in the body is something that will then make a lot of other factors that is in homeostasis, that is in balance with that factor, will also have to change accordingly. So that means by making a chemical change, you will usually have a huge distortion of the natural homeostasis. And that leads to other consequences. And a very interesting thing about side effects from pharmaceuticals, a lot of people think that side effects come from a toxic effect, but actually very few does. Of course, there are some toxic chemicals such as chemotherapy, and there are certain other drugs that are toxic, but most of them are not toxic. The reason why you have the side effects is that you're making an impact on the homeostasis. You're making one biochemical change, and everything else that is in balance with that factor has to change accordingly. And what also happens when you do that over time is that there is a process of adaptation. So you adapt to that situation as the new norm, and then it will be difficult for the body to get back to a normal regulation. And also what happens is that when you address chemically the symptoms, then it is difficult for the body to actually restore the main function, because there is an adaptation even to the problem itself. So when there is an acute problem that develops in the body, some challenge where there are too many factors causing something to be dysfunctional, then we have these mechanisms to try to deal with that. But if you suppress those mechanisms because you just want to focus on reducing the symptoms, then it will be more difficult for the body to actually resolve the problem. Now, adaptation can happen regardless. You can also have adaptation happen where something becomes chronic. You adapt to the situation as the norm. That can also happen by just having too many causative factors that in combination will cause a problem. But once there is adaptation to a problem, it means you cannot expect it to resolve itself. And even if you do something about the causative factors that made it develop in the first place, when it's already manifested and it's already perceived as the body as the norm, then that's when it's too late to just change the lifestyle, for example, to give better capacity for the body to regulate it. It might help, and it's always good to give the body more capacity to regulate, but you cannot expect that to resolve the problems that already developed beyond the point of no return, where this has been adapted to as the norm. So this can happen just from having too many negative influences where the combination of factor makes a problem develop, and where it's even the right thing to do for the body to give up trying to fix that. Because all these millions of processes we have to deal with challenges, there is a certain capacity overall to deal with them. And if too many factors are pushing in the same direction, we might get to the point where even if we don't interact or block any of those processes, it can still be too hard for the body to handle. And in that case, it is actually the right thing to do for the body to give up, because otherwise we start accumulating other problems too. So we need the capacity for the body's self-healing, self-regulating mechanisms to deal with the challenges. And if all the capacity is spent on keeping something at bay, or trying to fix something that can't be fixed because it's too difficult, then we need to give up on that and allow that to become the new norm so that we can have the capacity to deal with new challenges. Otherwise, we would then start accumulating more and more problems until everything in the body becomes dysfunctional. So the very philosophy of how health is addressed today, what's lacking, one is that the body's own self-healing, self-regulating mechanisms and these intrinsic processes to resolve issues and to compensate for issues are not accounted for sufficiently. And then when symptoms are looked at as the big problem, then we even suppress some of our body's capabilities of dealing with the issues. And this is why there is a need to actually have a medical paradigm shift where we acknowledge that the body needs to be able to have the capacity to regulate things, where we need to allow these mechanisms to work, where the compensation and healing processes should not be interrupted, and where we should rather support these processes, support them by finding out what factors are causing these problems and addressing those instead of addressing the compensations and the consequences, and also to support the process by giving the body more capacity to regulate. And this is the core philosophy of health optimizing's way of addressing health. And part of this is not unique to health optimizing, because even the old tradition, what's called traditional medicine, I know that some people today actually call the allopathic or pharmaceutical conventional medicine, they call that traditional, but there's not a lot of traditions actually in that. So in most of the world, traditional medicine means the old traditions, like the traditional Chinese medicine, and in all over the world, you have old traditions. And most of what they do is to support the body's own way of dealing with things. So it's a non-specific interaction where the aim is to support the body to self-heal. But the problem is that these methodologies are not very effective. They are better for prevention than for curing. And this is why when you could create faster symptomatic relief with the pharmaceutical approach, then that became kind of the norm today. So this is why the main paradigm today is the medical paradigm addressing symptoms chemically. So I'm going to show a slide to see a little bit the potential of these different directions. So let's see if we can share this one. So here's the history, where you see that even 3,000 years ago, you had the traditional medicine. And on the left side here, we have the effectiveness. So 100% effectiveness is not so easy to achieve. Obviously, that means you're fixing any health problem. Everything is fully resolved. Nobody needs to have any health challenges anymore. But we see that with the traditional methodologies that have existed for about 3,000 years, and most of them have not really evolved a lot, when you look at how many problems can be resolved with those methodologies, 20% is typically where you can show in trials that you can expect the average results to be. And only being able to help at a 20% level, in my mind, is not sufficient. Health is too important to be happy with only 20%. So in the mid-1900th century, so let's look at this blue line here, that's when the pharmaceutical paradigm started. So you see how fresh that is compared to 3,000 years. And in the 30s is when it really started to take form. And it managed to get to approximately the same level as the traditional methodologies in terms of perceived effectiveness, which means it's perceived based on symptoms, in around the 40s to 50s. And then from there, it has started to improve beyond that. So around the 90s, you are at a level around 30%, which is still not good enough. And after that, it has completely plateaued. So we don't really have a lot of progress in that type of approach since then. And also theoretically, the way I see it is that we don't really have much more potential with that approach, because when you're not supporting the body's own way of regulating things and you're actually working against the body's own way of regulating things, then how can it be possible to have a better effect than around 30%? And when you look at the statistics, half the population in the Western world have one or more chronic health problems. Half the population. And this is the Western world. When you look at countries where they don't have the current conventional medical paradigm, where it could be because they can't afford it, in those countries, you have more acute challenges that can be more challenging than in the West, but you have very little chronic illness. And that's not because everybody's dying of the acute, so it can't go chronic. On the contrary, it is because the challenges are not approached in such a way that drive things to become chronic. So it's very interesting to look at statistics from different countries where you see that the current approach of medicine today is actually making more chronic illness. If you look at Norway, so Norway is spending more money per capita than any other country in the world on health. This varies a little bit with different statistics that are published, but when you include everything, which most of the statistics don't, but when you include every expense of the healthcare system, Norway spends more money than any other country in the world. Still, we are topping the statistics for a lot of chronic illnesses, a lot of cancers. So health in Norway, when you look apart from those who have found health optimizing, then health in Norway is not really good when you look at the statistics. And when you look at other countries, you see a similar trend. The more money you pour into the conventional healthcare system that we have today, the more chronic illness, the more cancers, and there's a lot of different types of illnesses where it's even a lot more. You saw the same also with COVID. The more intervention, the more lockdowns, the more COVID vaccines, the worse off according to the statistics when you look at it in retrospect. It's really interesting, of course, to look at things in retrospect, because when you're in the midst of a process, everybody, should be trying to do the best with the information they have at hand. But we can still learn a lot from that afterwards when you see what trends actually influence the statistics. And the way it works is that if you have a model that by itself is not a very functional model in many ways, then pouring more money into that, expanding that model even more, can sometimes have a negative impact on the statistics when you look at chronic illness, when you look at cancer, and when you look at other factors. Where medicine has really progressed in a good way is in trauma medicine and also in surgery. So it's much safer to have a surgery today. You can do surgical procedures that you couldn't do just a few years ago. And also, if you crash your car and you need to be patched back together, there's no place better to go than a sophisticated ER at the nearest hospital. So I'm not saying that there's something wrong with the current model, and parts of the current model, they've progressed a lot and they really, really save a lot of lives. However, there is a need for another model in combination with those services from the healthcare system. And what is needed is a way to prevent health problems, and it's a way to deal with chronic health problems, and ideally also to deal with basically not developing more chronic problems than what is necessary. So it's the way that we also deal with the acute health issues that also translates to how chronic illness develops. So when you look at health optimizing's way of addressing things, if you look at now, well, we're in 2023, but made this slide by the end of last year. But already now we can resolve around 60% of the challenges that we address, which is twice as much as what you can do with a conventional, and it's more than what you can do with conventional and alternative / traditional medicine combined. And we have the proof of concept for that. We have clinics all over the world. There's a lot of different health challenges that we have a lot of experience with. We started the first clinic more than 20 years ago, so that the level of proof of concept is through many years with many clients and in many countries. So that means we have the level of proof of concept to stand behind what we're saying here, that the future is in this approach. That doesn't mean that health optimizing has all the answers and we should be the only one to provide health around the world. Not at all. But we have found the right direction that the world needs to go towards when it comes to health. And we need everybody to get on board with that direction, with the other industries also to get on board with that direction. We need a full paradigm shift where it's not only health optimizing like it is today, working in that direction, but where everybody is working in that direction, because that's really where the potential is. And I'm going to explain why the potential is in that direction. And that's the next section that we're going to go into now. But what I want to show is that even though we are already now at the level where we can really resolve a lot that cannot be resolved with any other methodologies, still there is the potential to resolve even more, and the theoretical potential with what we do, which is to find and fix all the primary roots of the problem. So instead of addressing compensations and symptoms, we address the roots. And to find the roots, we have really sophisticated technology. So it's a high-tech concept where we utilize all the latest technologies in medicine to find what is not functioning right, and then to address those factors at the roots. And that is how we are able to have a much better potential of resolving challenges. And it's no longer just a theory that sounds too good to be true, because we have the proof of concept for this methodology. And by developing technologies further, by being able to assess more and more factors and being more and more effective with our methodologies of addressing the challenges, we are improving how fast we can resolve things, how many factors we can resolve. And this is why we keep developing, and I believe that in this direction we can get to 100%. And I think that is obviously a bold statement, a world without any disease. But the way things are looking now, when you look at the statistical trends, if it continues in the way that it has been the last years, we could actually end up with a world without disease. But that requires a full medical paradigm shift. So let's talk a little bit more about health optimizing. So what we do is high tech. We utilize technologies for almost everything that we do. And that's where the potential is. There's no like magic pill. There is no magic methodology where you can touch someone in a special way and then all of a sudden everything resolves. It's in technology that this potential can be tapped into. And we have 33 state-of-the-art technologies, 33. And it's high touch, so we do a very comprehensive assessment and we make a tailored treatment plan. So when we have, let's say, 100 people with the same diagnosis, it could be chronic fatigue or it could be diabetes or whatever it is, if you have 100 people with the same diagnosis, you actually need 100 different treatment protocols, because we don't treat the diagnosis with a fixed protocol for the diagnosis. What we do is to find out what are the challenges that made this develop, and we fix those factors. And we have methodologies to address those causative factors that we can find through our very comprehensive assessments. And this is how we address the problem. We address each and every part of the roots of the problem, and we tailor-make a treatment plan with the best methodologies to address each and every one of these factors. And that's also the only way we can fix that. There's no health challenge or no diagnosis where we could use exactly the same protocol to treat everyone with the same diagnosis and expect to be able to resolve it for most people. We could maybe have some improvement for most of the people in that group, but to fully resolve it, you really need to resolve all the primary causative factors. Otherwise, it cannot resolve. Of course, there's no rule without exception, but this is definitely a rule where there are very few exceptions. and high value, because when you fix the problems, you can afterwards allow the body to regulate in the correct way. So there is no need then to keep taking pharmaceuticals or to keep going to have treatments. Like, we don't want our clients to come back regularly for treatments. We want to fix the problems so that our amazing self-healing, self-regulating mechanisms, which we are all born with, that they can deal with the challenges, that the self-regulating and self-healing mechanisms we have intrinsically, that they have the capacity to function, that all the main functions are intact, and that we don't need to make any external intervention, and then to have just a yearly assessment, a follow-up check, to see if something still developed a little bit, and in that case to resolve that before it develops too far. So what we are targeting most of all are the causative factors, the causations, and we have three categories of that. Of course, there are thousands of factors, but they're in three categories the way we see it. So one is the underlying causations. These are predisposing elements. They're unique for each client, and these are the factors that make it possible for health problems to develop. So without the underlying causations, you would typically not develop problems unless it's something like an extreme accident or something like that. And underlying causations include genetics. That's a factor that we cannot do much about today. I think in the future we might be able to also address genetics. But even a high genetic disposition is still usually a secondary underlying cause. It's not primary. We call it a high inheritable disposition if there's more than 15% increased risk. So that by itself shows that even what is considered a high disposition from the genetic point of view is still less than what is still a low percentage. Like, we consider it high at 15%. So it's not very high. There are other factors that are usually much more dominant. And to resolve a challenge, a health problem, we need to at least resolve all the primary factors. And luckily, it is rare for genetics to be primary. Genetics is very often involved, but it's usually secondary. And we can resolve health problems by fixing the primary, even if we don't address all the secondary factors. And trigger factors, that's what's triggering the development. Let's take the example again of the flu. So you get the flu. What do you blame for getting the flu? You blame the flu virus. But when you look at statistics again, 82% of the population in Norway are tested positive for the flu virus. Of course, they don't test the whole public, but when they test groups and then you scale it up, you can calculate that it's about 82% who test positive for having contracted the virus. However, it's very far from 82% who get the flu. That's varying from season to season, but it's typically 10 to 15%. So why is it that we blame the flu virus for getting the flu when the vast majority of people who get the flu virus, they don't get the flu? They don't have any symptoms of the flu. This is because the flu virus will only cause the flu if the immune system is occupied with something else or don't have enough capacity to deal with it, because there are other challenges going on. So we don't have the ability to deal with such a simple task as dealing with a flu virus. So the underlying causations, which could be that the immune system is occupied with something else, it could be that there's an issue at the cellular level where the virus can more easily access the cells, or it could be that there are certain stress regulations, or that there are psychosomatic problems so that the brain is not able to activate those immune processes well enough, or maybe we suppress the immune functions by lowering the fever once it comes. Whatever it is, well, that last one wouldn't be an underlying causation, but it's an example of how many things can interact and cause this to become a problem. And the virus is just the trigger that trigger the process. So a trigger causation will typically only be able to trigger the problem if there is already a combination of underlying causations. And those underlying causations, they would not be able to caused the problem unless something triggered it. So you need both. But there's a third category, and that's what we call aggravating factors. So these are the factors that throw gasoline onto the fire, or that can be responsible for why we didn't have the capacity to deal with the problem when it was early emerging. So it's compromising the intrinsic capacity to deal with the problem. But mainly you need a combination of the first two for a problem to develop, and then it can be made worse by the third category. All right, so let me stop sharing here a little bit again. So I wanted to explain a little bit more about the methodologies that we use in health optimizing. And I also have a few slides to show that. But basically what we do is that we start out with a very, very comprehensive assessment. So we're looking for all those pieces of the jigsaw puzzle that we need to find and then put together to understand what is going on. Because otherwise we would be only able to kind of address symptoms and the factors that we know about from other reasons, like maybe there's some blood test that is showing that something is out of balance. But blood, is just a transport channel, and most of the problems in the body, actually more than 99% of what is going on in the body, you cannot find indications of in blood. So there are certain problems where that will lead to a certain imbalance that can be picked up in a blood test. But again, it's less than 1% of the challenges in the body where you can find anything in the blood that can tell you what that issue is. And when you do the imaging tests, you can find many important factors with MRIs and CT scans and PET scans, etc. We definitely need those methodologies, but still, it's just a picture, it's just an imaging. Most of what is going on in the body cannot be detected with those methodologies. So what there is a need for is to really be able to assess what is going on in the body. How are the different functions? Like, how is the autonomic nervous system regulating things, dimming processes up and down? How are the different organ systems functioning? How is the situation at the cellular level? Because physically our body is comprised of cells, and these cells, they have very important functions, and to actually measure those cellular functions and measuring the way the cells produce energy and the way they exchange ions, and all these different factors that today it is possible to measure. If we go 25 years back, it was not possible to measure any of these factors. But there has been such a vast exponential development of technologies in medicine, actually even more vast and exponential than in other industries. When you look at your mobile phone 20 years ago and you look at what it is today, it's an enormous difference, and there's so much you can do with your smartphone today that your 20-year-old phone could not do. And this is how it is in every industry today. There has been a huge exponential technological advancements that has made different tasks much easier to perform. But in medicine is actually where you have had some of the most incredible advancements. However, these advancements have not been incorporated yet into the conventional healthcare system. And the reason for that is that they don't fit the box. Like, there's a very rigid box that one works within in the conventional system. It's the conventional box. And anything that doesn't fit the box will not be implemented until the box expands. And that is a very slow process. So in average in Norway, which is considered also the most technologically advanced country in the world, whether it is or not, at least it is up there at the top. It's an 18-year lag from a medical technology is approved. It's approved for use in hospitals. It's validated. From the approval until it is implemented, it takes 18 years in average. And then some of these methodologies, they fit the box. So they're implemented the first year. And that shows that those that don't fit the box, it's even more than 18 years, because 18 years is the average, including those that are implemented right away. In United States, they estimate 20 to 25 years. So it's even longer before it's implemented. And that's the average. And when you then see that in technological advancements, it's amazing what has been developed during those years where you still are in the lag of implementation, then there is a massive potential in faster implementation. And this is what we do in health optimizing. Instead of working only with that conventional box, we have made a box for all the technologies and for this approach in health to be able to utilize all these amazing tools in diagnostic assessments and treatments, so that any new revolutionary advancement in technology in health, we will make that fit into the concept so that we can help people in a better way. Instead of having to wait for the box to fit it, we implement right away. And we are by far the fastest implementers when it comes to technological advancements in health. And the philosophy of how we utilize these technologies is we don't want to address compensations. We don't want to just address symptoms. We want to use the technologies to find out what is not functioning right in the body. Why is it not functioning right? What are the causative factors? And we address each and every one of those causative factors in parallel with also repairing the damage that has been caused by having these problems for a long time. So we create the restitution needed for having a healing potential. And then the last part of it is to stimulate the body to regulate in the way that it is intended. Because this phenomenon I talked about previously about adaptation means when the body perceives the problem as the norm, it will not resolve by just fixing the by fixing the causative factors and giving the body more capacity. We also then have to stimulate those mechanisms and again make the body perceive what the correct norm is. Well, if we only get the body to do things the right way and the body had given up because of the causative factors were too great, then it will just give up again. So first we have to create a potential for healing, and then we have to stimulate how the body regulates this. Let me pull up my screen again here. And there. So the process, the patient experience is that we first have this comprehensive assessment, and with a combination of technologies, we can measure up to 20,000 health parameters. So just to explain how much that is, if you go to your doctor and say, I want to test everything, you will probably have around 50 factors tested. If you go to all sorts of specialists and you do all sorts of specialist tests, you have a few hundred. But 20,000 health parameters with the same level of accuracy, and where we can really figure out the roots of the problem, that's when we can really be able to address it. Then we make a personalized treatment plan for addressing each causative factors, increase the potential for healing, and then finally stimulate the self-healing and self-regulating mechanisms. And then it's about lifestyle, because for those who did not have a sufficient lifestyle to have the capacity for these intrinsic mechanisms to deal with things, then we also help with improving that capacity through lifestyle. But it's not through lifestyle that we fix the problems, but lifestyle is really, really effective to avoid new problems to develop. So here's just some examples of factors that we assess in our main assessment. This is the assessment we do for every single client before we make a treatment protocol. And just showing a few screenshots, but again, it's 20,000 factors, and we can see even at the cellular level what is going on, how ATP is produced, how the ions are exchanged over the cell membrane, how the dielectric properties of the cell membrane is, which is what needs to be sufficient for the ions to exchange, and then how the functions of the organ systems are, and how things are dimmed in processes from the autonomic nervous system, how the brain regulates things. Like, we can really, with the combination of technologies, we can map out exactly what the challenges are, what's causing them, and what we need to address to resolve the problems. So a little bit about our history and how it's possible to get involved, and then we will move on to a Q&A after that. So we started the first clinic in 2002. So we had a 20-year jubilee in December last year. So it's less than 6 months ago. Before that, I had been working on the development and basically the R&D, developing the concept, working with institutes around the world to develop the technologies. And then when we had the first 2 technologies, which were prototypes that needed to be tested, that's when we built the first clinic, which was a research clinic. And we built the first clinic open to the public in 2003. And since then, we have been building clinics all over the world. In 2013, we, for the first time, named a clinic Health Optimizing. So we built a new and bigger clinic in Bergen. That's where the mother clinic is. That's also where I'm from. It's in Norway. And the first Health Optimizing branded clinic was there in 2013. In 2018, that's when we built the franchise. So until then, all the clinics, they were testing our protocols and methodologies. And what we gained from that was the proof of concept, because we wanted to be able to test things in a larger scale than what we could do in just one clinic. And we also wanted people to get access to methodologies that were already there. But during those years, we didn't have all the solutions that we have today. And in 2018, that's when we felt that now we have solutions to more than half of the health challenges people are struggling with, and we have solutions to so many things that there are no other solutions to. And this is when we actually have to really start building clinics that are not just research clinics, but where we can offer the methodologies that we already have, and where we can help with those things that nobody else can help with. So we built a franchise so that anyone around the world who wants to start a clinic or convert an existing clinic, they can have a turnkey operations for how to do that. Either to start a clinic from scratch, we have all the methodologies for that, or to convert an existing clinic, we have all the training, we have all the support, we have all the systems. And this is how we felt we could bring this to the world in the fastest way, so that those health professionals around the world who really want to help their clients in the best possible way, and they just need better tools, then we can provide that, and also the training and everything to go with that. In 2020, we had representation in 5 continents. We don't have big clinics in 5 continents, but we had a representation in 5 continents. In 2022, we opened up again to start new partnerships, and also for people to take over territories, for companies to start building a territory and help potential franchisees in those countries. So it's a way of being able to scale things better. And in 2023 is when we opened up also for investments into the company. So we are at the point where we want to scale things faster. We want to build more clinics. We want to develop more technologies. We have several new inventions that needs to see the light of day. And we are at the point where we want to scale things faster and move faster towards this paradigm shift. And that's why we now want to open up to investors. And that basically concludes what I wanted to talk about in my presentation, but we now have about 10 minutes also for a Q&A. So let's open the floor to that.
Very good. Thank you. Appreciate that. While we're waiting for any questions that come up, and I see a couple of them, one of them being, what is the documentation that potential investors can receive? What would that process look like?
So we have investment decks with all the different information, and we have the business plans, and we have all the numbers, and basically we have that can be provided, but there is a need to sign an NDA first, a non-disclosure agreement. and then we provide a basic package of information, and then after that we will reply to any questions that a potential investor might have. This is something that primarily is dealt with by our CEO, which is Roger Hovland. He has many years experience building big companies internationally. So he came on board to the company in 2015 to help with the international expansion, which he has done for 3 of the biggest companies in Norway previously, who became really, really big internationally with his help. So we have also the experience for that scaling, and he's the one who will conduct most of that dialogue directly. But also our head of franchise will be able to answer those questions relevant to how the franchise works. And if there's any question about the technologies or methodologies, I'm happy to answer that. Any questions around the education, we have our head of academy, Sara Helali, who will answer that. Head of franchise is Agne Petruskaite, and CEO is Roger Hovland. But basically just get in contact with us. We'll make sure that the right people will answer the right things.
Okay. Of that contact, should we put the information for Roger in the chat area, or how would people go about? Should they go to the website and connect in there?
So at healthoptimizing.com, you have information about health optimizing and about the concept, but you also have the contact information to the people I just mentioned and their bios. So through healthoptimizing.com, you will very easily find the contact information.
Okay, very good. Any other questions, please? Please feel free to unmute.
I see on the chat there is a question: do you have representative franchisees in India? So the answer is no. There is a very interesting dialogue ongoing in India, but we don't currently have any clinics, and there's no contract signed for India yet.
Okay, kind of along that same vein, are there certain countries where you have higher priority in terms of developing, considering the market conditions? I would say have an extra high priority on those countries where we have a lot of people who are already coming from those countries and have to fly quite far. So I would say London probably now is our highest priority. We have a lot of people from London who desperately wants our services, and we had for a period a clinic in London, but we had to give up on the collaboration we had there, and we want to now, with partners, build a more professional clinic in London. Other than that, we are for the first time planning now to open up in the United States. We have previously not really been much active in the United States because we didn't have the FDA approvals. So we had all the approvals in Europe and certain other parts of the world where the European registrations are sufficient to get a very simplified process of registering in those countries. But that's not how it is in the United States. You actually have to go through the process as if you never had an approval anywhere else in the world through the FDA. So now we have that. We have all the core parts, the most important parts are FDA approved. And this is why we are finally now ready to get things moving also in the United States. Okay.
Even though there are still some technologies we're not fully, we don't have all the approvals for, but those are the less significant ones.
Okay. That addresses one of the questions there in the chat area. And then another question is about Africa. What are your thoughts there?
So in Africa, we have actually our biggest clinic is in Africa. It's in Cape Town, or outside Cape Town in Paarl. And this is a retreat clinic. It's a 5-star retreat that also has accommodation, and it has healthy food and a spa and a full health optimizing clinic. And that retreat has been awarded now, I think it's 4 or even 5 times the best retreat in South Africa. And 2 times it has even been awarded the best retreat in the whole continent of Africa. So that's something we're actually quite proud of.
Fantastic.
Other than that, yes, we are looking to expand in Africa. We are looking to expand in the whole world because we have methodologies that the world desperately needs. And the only way we can give people access to that is to build more clinics. Because even though some people have the means to fly to another part of the world to go to one of our clinics, but we have limited capacity in our current clinics. So what we need is more clinics, and instead of having clusters of a lot of clinics in one area, we really want to spread them out to make it more easily accessible to those who are in need.
Is there a way to retrofit hospitals to the methodology and the technology?
Yes, there is. The ideal would be that the hospital will keep some of the things that they already have. So you could have a wing with health optimizing, but you still would need the beds, you still need the emergency room, you still need the surgical theaters, but it will go very, very, very well hand in hand with a modern hospital to have a health optimizing wing that can offer these additional services. But currently, we are not in any hospital setting. Currently, all the clinics are private external clinics.
Okay, that sounds like a great opportunity. We're right at the top of the hour, and I just had a couple quick questions, and then we'll, I think, probably wrap up unless you'd like to approach it a different way. One question relates to Richard Branson. He's mentioned in your bio. Curious to see what that relationship is, and maybe even if he's seen this and is a potential investor. And then secondly, what other additional things should we know, and what other comments would you like to make before we wrap up?
Okay. So Richard Branson invited people who had ideas for solutions for bringing the world forward in different categories. So he had a committee that put together, like, what are the biggest challenges in the world today? Obviously, health is one of them. And who are the people around the world who seem to have a potential solution for the future. So his idea was to bring together all these people who had solutions for taking the world in a better direction and put them together for a week where he was personally also part of that, and to see how can we help each other brainstorm to bring things forward. And that was a very, very interesting process. When it comes to who has been to our clinics and used our services, I cannot answer that question because that would be super illegal for me to say who has utilized our services and not. But what I can say is that a lot of our clientele are very, very interesting people who you have all heard the names of, but I cannot tell you who.
Fantastic. Thank you. Thank you for sharing. What additional information would you like to close with? Very fascinating conversation, a really in-depth understanding, I think, today of what the overall methodology is and how in-depth it is. I'm curious if there's some sort of an artificial intelligence angle to it in terms of, you mentioned 20,000 data points and custom solutions for each situation. Fascinating answers and technology. What additional comments would you like to make, and what should we be left with?
Yeah, so we are actually developing also artificial intelligence systems to put the pieces of the jigsaw together, because the more pieces of a jigsaw you have, the more difficult it is to put them together. So we have very interesting development projects for that. No, I think to answer that second question of you, what I really want is for everyone to have an opportunity to change their paradigm. Like, the only way we can really, really shift the paradigm is to educate everyone on how the body actually deals with things, how we should support these mechanisms rather than overriding them, how it's not your medical doctor who is in charge of your health. It is you who are in charge of your health. You need to make your own decisions, and I really urge everyone to try to think a little bit more carefully about what those solutions are, because there are better ways than those ways that are typically offered in a conventional setting today. And for those who also wants to get on board by helping us educate the world, or helping us with research projects, or wants to get on board to build clinics, or wants to get on board as an investor, like, it's a massive mission we're on to redefine the medical paradigm, and we need as many people to get involved with that mission as possible for this to happen faster. I mean, this paradigm shift is happening whether we like it or not, and it's going to happen regardless, but we want it to happen sooner rather than later, and we want that those solutions that already exist should be made available to people who are in need now, and not just in the future. So we want to bring what already exists today to the people in need in a larger scale, and we can't do that alone. So we need people to partner up with us in this incredibly important mission of redefining the medical paradigm.
The whole overall methodology talked about underlying trigger and aggravating sources was fascinating. I wonder, maybe in conclusion, the impact that this has had on your life. And I remember you also talking about some athletes who have used some of the methodology to be able to reach really extraordinary performance levels. What would be some examples of things that we should take away in terms of what the methodology has done?
Yeah, so there's also the potential to take things beyond just fixing health problems. And this is also why we're called health optimizing, because it is about optimizing health, making the most out of what we have. And there's a lot of people who perceive themselves as not being sick, but they still don't have energy to have an amazing life. Like after work, you get tired, you have some dinner and you sit in front of the TV and you don't have the zest for life, and you don't really enjoy life that much. But it doesn't have to be that way. It's possible to have almost an abundance of energy, and it's possible to really enjoy life at a completely different level, to maintain the attention span much longer, to be able to sleep less and still be more rested. Like, you can get so much more out of life by optimizing beyond just not having illnesses. And these methodologies that we have can also help tap into that. We can find not just the real dysfunction, but also where is there a potential for improvement, to improve beyond just being within the norm. Like, how can we tweak things to be in the better than the norm, and how can we really help you thrive? So that is also something that for the future I'm very passionate about, helping those who wants to thrive, to help them be able to do that. Like, some people call it biohacking, but it's really just comes down to optimizing every element of the body, to give the body more capacity, to tweak those things that are already not functioning optimally, to make the changes to the lifestyle that matters, instead of just changing a whole bunch of stuff because it's a trend to change it. Like, there are certain changes that will matter for you, certain other changes that will matter for someone else. So these assessments, we can find out which lifestyle changes will really give you more capacity to deal with anything, or just enjoy having that extra capacity. And for athletes, if you get a little bit extra energy and you feel a little bit extra, if you optimize at different levels, it translates also to performance. So a lot of the athletes we have been working with, we started with them at a lower level, and now they've been excelling in different sports. So we're not allowed to mention names of those who are still in their career. But some of them have ended their career and come out afterwards and told the world that that we were their secret weapon, or at least one of the factors that made it possible for them to do this. So on the website, you will find a couple of examples of that. Athletes who had an amazing career, who won gold medals in Olympics and multiple world champions, who now have come out and said that health optimizing was absolutely essential for them to be able to do that. So I think there is a potential for almost everyone to be healthy and to resolve their health challenges, but I'm really excited about helping people take it beyond that and also make more out of life.
Thomas Aksnes, thank you so much. Fascinating information. Healthoptimizing.com, headed to the future with what a great mission to be able to allow people to live a better, more fulfilling, enjoyable life. Nothing more important than that. Thank you so much. Have a great day. Thanks everybody for attending. The end of the recording coming up. Take care. Thanks, Thomas. Fantastic conversation today.
Thank you.
We'll get
Thanks for
the
having me.
recording out and put it up a blog post and get this out to folks over the next couple of weeks.
Excellent.
Thanks, everybody.
Okay. Thank you.
Cheers. Good night.
Yes.